At American Physician Partners, we strive to deliver a high-quality, patient-centered care experience rooted in an evidence-based clinical practice model. We are continually striving to advance our care platform to ensure our patients receive the very best health care possible and our providers are able to achieve the very best quality outcomes for our patients. As a provider on our APP team, you can expect to be well-resourced, supported, and fully informed regarding all of our quality initiatives. Our local medical directors do an excellent job of leading our teams at the local level and provide continual communication regarding our KPI metrics, quality initiatives, and other key programs. We focus heavily on communication and ensuring our providers are continually updated and educated on our initiatives to ensure consistency in care. At times, you may wonder why we measure, track, and trend all of these KPI metrics and quality outcome measures. The volume of metrics, numbers, and percentiles reported can be overwhelming to us at times. The reason this is important is really simple. Our patients expect for us to deliver them a consistent quality care experience, and these numbers simply help us track our progress in fulfilling our commitment. Each number indicates where we are in the journey to excellence in achieving this goal for our patients. That is why we celebrate every win and recognize our team for exceptional performance, because it reflects achievements of our intention and fulfillment of our commitment to exceeding their expectations. We want to share our KPI metric performance monthly with each of our provider teams to validate where we are in the journey to excellence and further seek ways we can continually improve. In our monthly operational management meetings, we look for any barriers that exist preventing our department from achieving best practice outcomes for our patients and collaboratively working with each of our hospital partners to develop performance improvement plans to further improve. Following our lean principles of plan, do, check, and adjust allows us to continually move each department forward in our journey to excellence. As we define our best practice care experience and consistently achieve it, we will continue to redefine what excellence looks like and seek to improve to be even better. Our patients deserve our best and are counting on us to deliver that with each patient care visit. It's about exceeding expectations one visit at a time. Next, I'd like to briefly summarize a few of our key APP quality initiatives currently underway across our company. We began our Champions for Sepsis initiative this year. We set out to achieve an overall reduction in sepsis mortality across our company through implementing a consistent best practice process that allows for early identification, standardization and early goal-directed management, and coordination and follow-up care to improve overall outcomes and reduce mortality. At APP, we are fully engaged in our eQual Sepsis initiative and began this initiative by standardizing the education and the staff's understanding within each of our departments around evidence-based best practice management for acutely septic patients. This was followed by a coordinated effort to build a connected care experience between our inpatient and critical care colleagues to ensure aggressive management was uninterrupted post-transition from the ED. We worked with each of our hospital partners to assess their sepsis mortality rates and are tracking those going forward. Since inception, we have noticed a significant improvement in our sepsis core measure compliance and overall reduction in sepsis mortality. We are in the process of translating this into patient lives saved and will cumulatively report this powerful quality achievement ongoing. Our Opiate Management Initiative. Our country is suffering from a significant opiate and prescription drug dependency crisis. The emergency department sits squarely in the crosshairs of this epidemic, and we play a critical role in helping ensure we practice safe pain management for our patients. It is our duty as physicians to be thoughtful, systematic, and conscientious caregivers as it relates to opiate use and misuse. How we manage these prescriptions in the emergency department can be the difference between creating addiction and healing. As a company, we want to work with all hospital partners to implement a consistent platform for safe opiate prescribing, along with our process to monitor our opiate prescribing patterns. The fundamentals of our program are rooted in evidence-based best practices regarding opiate management and coordinates resources combining clinical best practices, case management, and the utilization of each individual state prescription monitoring system. We have educated our provider team on the opiate epidemic, best practice guidelines for safe prescribing, and enrolled each provider in their state monitoring program. Our threshold is to limit all opiate Schedule II prescriptions dispensed from the emergency department to be 3 days or less. If abuse or misuse is suspected, the provider will access the prescription monitoring database, and if concerns for inappropriate use arise, a referral to case management for outpatient follow-up is initiated. If a situation arises requiring a deviation from our recommended prescribing guidelines, an occurrence form is completed indicating the reason why and referred to our medical director for review. It is our goal through education, standardization, and coordinated teamwork we can positively impact our communities by reducing dependency and practicing safer medicine. Patient Experience Initiative. We value our patients' feedback and bring to each partnership a patient experience survey tool to assess our patients' satisfaction with their care experience. The information obtained is valuable as we work to hardwire key behaviors in our care team that drive a high-quality, compassionate care experience. By focusing on conveying concern, compassion, and communicating effectively with our patients to be sure they fully understand our evaluation, results, and plan for their continued care, we use this objective surveying tool to assess our providers' performance and measure our success in achieving excellence in the patient care experience. Reducing ED length of stay for admitted patients. As a premium emergency medicine management company, we are focused on bringing value to our hospital partners and helping to achieve enhanced operational efficiency in all areas. To achieve the greatest efficiency in the emergency department and deliver best practice front-end metrics, arrival to provider, and reducing missed opportunities with left without being seen, we need to also focus on improving the flow of admitted patients into the inpatient units. Organizational flow drives ED flow, and when we have a congestion or delays on the admission transition, we lose ED capacity and bed space, limiting ability to initiate care for new patients. We are focused on achieving the best metric times possible by working in collaboration with our hospital partners, nursing staff, and medical staff to hardwire best practice processes that will streamline the admission process. As we reduce the ED length of stay for our admitted patients, our ability to see new patients improves and we reduce our arrival to care and left without being seen metrics. The 4 critical elements that need to be hardwired to achieve optimal length of stay times are the following. First, streamlined provider-to-provider handoff. Empowering the ED to control bed assignments for admitted patients, which should occur in parallel with the admission handoff conversation. No-call nurse reporting to streamline communication of critical admission and transition of care information without pulling either caregiver away from the patient care experience. Dedicated transport to expedite transfer of patients to the inpatient unit. These processes, when embraced and consistently applied, drive significant reductions in length of stay times and provide a safe care experience for our patients. Additionally, patients feel valued when their care is connected and they are not held in limbo with no active care management occurring as they wait for their care transition to be completed.